Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and yes, we are doing our, I guess we're calling it monthly Q&A, question and answers, and yes, brought to you by you. So I'm here with Maria, live. It's been a while,
for
right?
The first time.
Been pre-COVID, we were close, disclose. You look fantastic, excellent, beautiful, and young. We're going to go ahead and answer your questions that you guys sent in mostly through social media. So you want to check out and make sure you listen because your question may be asked. So what do we got today, Maria? I actually think some of these questions were excellent, so fire away.
Okay, so the first one comes from Layla_Marinella.
Layla_Marinera.
Marinella.
I love marinara. I'm a big fan of pesto.
Marinella.
Okay, my bad. Go ahead.
Do fillers like Botox, hyaluronic acid become dangerous after a long period of time to the blood system?
So the question is, do fillers and Botox, when they're in your face for a long time, have issues with blood? So let's first off, many people throw a Botox filler all in the same, they're bowling balls and limousines. So Botox is Botox, filler is filler. So Botox has nothing to do, no issue with bloodstream. Filler, on the other hand, does have issues with bloodstream, but it's not related to long-term. It's the day that they're injecting. So when you inject filler volume, and you have two risks. One is that you actually physically inject filler into a blood vessel. That's what causes like noses to turn black and necrose, people to go blind. You're looking at me like, yes, there are instances where people have gone to their doctor, nurse, whoever, got an injected filler and they went blind. Or they got injected in the area in their nostril because they got direct intravascular into the vessel injection, and then they push it and it causes a thrombosis in that. The other is if you put a lot of filler and there's so much pressure, it can squeeze the vessel and cause it not to work. But those two issues are immediate. It's not a question of like, 8 months later, you're going to have bloodstream issues. It's when you're getting it injected that you need to worry about it, not down the line. So not in the long term, but upon injection.
Now, when people get fillers, sometimes they'll bruise. That's normal, right?
That's bruising. That's just oozing of blood vessels because you're getting poked. This is totally different. This is actually going into a major vessel and closing off that vessel.
Okay. Well, I hope you got your answer there. Okay, the next one comes from Amanda V. Carlton.
Amanda V. Carlton.
After fully healing from under the muscle implants, can one still do chest-related exercise?
Great question. So from having a submuscular under the muscle implant, can you then do chest exercise? And the answer is absolutely. You can do everything you were doing before. I mean, you won't do it immediately, as she said, well written, but you can do anything and everything you were doing before with essentially no limitations. However, I usually advise my patients not to do a lot of heavy pec-related exercises after a breast augmentation or breast implant placement because every time you fire your pec, the muscle squeezes, forces the implant down and out towards the armpit. And over time, not 3 weeks, not 6 months, but over years, you start getting displacement of the implant out laterally, meaning your implants start to look like they're shifting farther apart because your muscle is actively pushing them out. So you can do a push-up and you can do everything, but I wouldn't get breast implants and then start being a bodybuilder and cranking your chest. You can do your biceps and your triceps, but repetitive pec exercises I usually don't recommend, even though you can do them.
But should you wait a certain amount of time to do it?
Once the soreness is gone, it's fine.
It almost feels like, when you're going to have surgery, they tell you don't drink water after 12 o'clock, and then at 12:01, you want to drink water.
Yeah. All of a sudden, you have
now they want to have pec exercise. Why do it? Wait a certain amount of time.
Yeah, well, at any rate, I think the reality is that most women, with the exception of those that are super into bodybuilding, don't really ever work out their chest anyways. They'll work out their quads or work out and get a little muscle tone, but nobody's usually not getting wrecked. So.
Okay, the next question comes from VNS SLMB.
Not going to even bother trying repeating that. Go ahead.
Thoughts on using a silicone implant or rib cartilage and silicone implants for rhinoplasty?
Right. So the question is, when you use an implant or rib to be part of a rhinoplasty. So let's back up here. Why the hell would you even want to do that? The majority of patients who get a rhinoplasty are coming because they have a hump or a bump. You want to remove that bump. But there are a subset, African Americans, Asians, and some Latinos who have a very flat bridge, and they want a stronger bridge, which is the exact opposite of what you would do on my nose. When you want to build a bridge, not remove a bridge, you got to add. So what are your options? Option one, you can go, there are solid silicone implants, like the one we use for the chin, and you can just slide it in there and call it a day. It's super easy. Its issues are, number one, theoretically, it can get infected. And more importantly, it ends up never being fully natural because, like, you can usually grab it, it's mobile, it shifts. It's done, I don't know, millions of them are done in Asia. I mean, it's the number one procedure there is to, like, in an hour, you get a rhinoplasty with one of these implants. But in the rest of the world, we tend not to use it as much. The second is to make it out of cartilage. So where do you have that much cartilage? In your ribs. You take out a little piece of rib, the cartilage of the rib, not the bone, and then you have to carve and shape make it like an implant out of your own cartilage. The benefit is it's yours. Sorry, it's alive. You're not going to get it infected. But the downside is, one, it's a pain in the ass. You got to go grab a rib. And the other is that cartilage tends to have the risk of warping or moving over time because it's alive. The third, which wasn't mentioned, is the technique that I use, is something that was discovered, or I hate to use invented, but was created by a few surgeons probably about 10, 15 years ago, and it's called a burrito effect, a burrito or dice graft cartilage. And basically the gist of it is you can go inside the scalp area and take a little piece of what's called fascia. Just think of it as cigarette film, cigarette paper. Then you can take any cartilage you want. Like I take septum in every case, and you dice it up into a fine powder, and then you roll it up like a cigarette, and then you roll that whole construct and create a bridge that way. The reason I like that is, number one, it becomes adherent, meaning it sticks. And number two, it's a little malleable, meaning you can kind of massage it into shape for the first few days because it's powder. So anyways, those are the ways to build a bridge. And yeah.
Wow.
Yeah.
That's interesting. Okay, so the next one comes from Annette Marie.
Annette Marie.
Weight fluctuations with implants, winter bod to summer bod impact.
Weight. So generally speaking, slight fluctuations in weight generally don't have dramatic effects on our body, whether it's your breast or your face or your abdomen. The issue that we're having today is there's a tremendous amount of significant yo-yoing. So what that means is probably 20, 25 pound fluctuations. And with breasts, it's just going to make your breast sag. Every time you gain 25 pounds, your breasts get larger. Now,
I can relate.
Right, yeah. Some patients, like you, have 25 pounds. 20 of them feel like they go to your breast. And some patients are like, shit, I gain weight. None of it, barely any go. But I assure you, everyone's breasts will get somewhat larger. Then when you lose the weight, they deflate. And they tend to get stretched and deflate. Stretched and deflate. And so anyone who's lost a tremendous amount of weight will tell you their breasts or their arms or their bellies have gotten saggy. So small fluctuations, no problem. You got to just in general try to stay just like, you know what I mean? Flat line. High school, I weighed 155. Right now, I weigh 170. I've weighed that way for 30, years. And, I notice my weight going up. I'm on crazy mode because I just don't want it to keep going up and down.
But, I was always up fairly even keel with my weight. But after menopause, I jumped up. So
yeah, everyone,
as you get older, it's a normal part of...
No.
Well, not normal, but
as you get older,
yes.
It requires more effort to stay the same. Before you did nothing, you drank at night, you ate Taco Bell, you got up in the morning, and you had a six-pack. Then you had to, well, shit, I can't eat after. And so it just becomes more difficult because your metabolism slows down, so you have to be much more rigid with your diet.
Yeah, it sucks. Okay, the next question comes from Ilanitz, Ilanitts.
Okay.
Share your thoughts about women seeking surgeries in Turkey. This I hear all the time. I don't know what it is about Turkey.
What it is that, listen, so it's
a fad now?
It's not Turkey. It's the following things. Number one, what she's referring to is destination plastic surgery. So destination plastic surgery is the following notion. The first question you ask is, so why would you leave? So the idea is that I, as a patient, can leave America and go to Venezuela, Colombia. Turkey is a very popular place, and go and get surgery get it done way more affordably, and make a mini vacation out of it and take my family and whatever. So there are many upsides to it. But I highly caution you against doing destination plastic surgery. In Turkey, it doesn't matter if it's Turkey or Venezuela or Colombia or anywhere else. And I've had many podcasts on this. And these are the following reasons. Number one, let's make the assumption that that surgeon is phenomenal. Let's not even go there and act like, oh, we're better here than the Turkey. No, there are some really great surgeons in Turkey, as there are in other countries. So let's just delete that from the equation. The guy in Turkey is awesome, but he's no more awesome than some guy in the United States of America. You just have to find that guy. So what are my concerns? Number one, in all other countries but the U.S., you have no advocacy. Zero, zilch, nada. Doctors rule. So if something goes wrong, you have no recourse. There are no, it's not that you literally, the smallest thing happens, I'm going to hire a lawyer. You have Yelp. You have a medical board. You have a ton of recourses that if something doesn't go right. Secondly, while it is rare, when something doesn't go right, you're in the middle of nowhere. So let's say the doctor's badass, but is the ICU at the medical center badass? If you end up having a pulmonary embolus, do you think the pulmonologists are badass? Do they have an ECMO machine which allows you to be on life support? So you're doing it out of insurance. So nowhere in the world is healthcare better than the U.S. and available readily like they are in the U.S. And lastly, you do your surgery, high five, nothing happens to you, you get your ass on a plane and you fly back to the United States of America. Then your incision opens up.
Then what do you do?
Now you got pus pouring out of your breast implant. And, well, let's just jump on a Zoom, shall we? What are you going to do with a goddamn Zoom? You're going to have to go to the ER, and some other doctor's going to have to pick up your shit and fix it, and it'll never be the same. So in general, it's just foolish. It's risky. And I recently had a patient who had the most bizarre complication at 7 days. She almost bled to death, and we couldn't even figure it out. We had to take her to the hospital. What would we have done if she'd already flown back to Nicaragua or wherever? It's just a bad idea, Matt.
Yeah.
You know what? There are so many great surgeons here in the U.S. that you don't need to do that. It's just bad idea.
You're putting yourself at risk needlessly.
For no reason.
Yeah.
So if you can't afford it, then just do it.
Even if I could or couldn't afford it, I would never go outside of the country.
All right, well, let's take a quick break. You got more?
Oh, hell yeah.
Okay, yeah. Oh, hell yeah. So I'm rubbing off on you. All right, we're going to take a quick break. We'll come back and we'll do some more questions after a few messages. Sounds good?
Sounds great.
We'll be right back. All right, welcome to the second half. All right, Maria, what you got for me? Let's keep going. We're going to keep going with Q&As. Let's see if we can finish all these. What do you got?
Okay, so next one comes from Rosalie 817.
All right, Rosalie 817, here's your question.
When getting a tummy tuck, when are we out of the danger zone of getting a blood clot?
Perfect, great question. Generally speaking, my thought process with all procedures is the danger zone, infections, blood clots, and bleeds is about 2 weeks. Doesn't matter if it's a breast dog, doesn't matter if it's rhinoplasty, doesn't matter if it's tummy tuck. Usually it takes about 2 weeks for the wounds to heal enough that you don't really run the risk of infection. You're ambulating enough and you're walking and you're not going to get a blood clot and all the vessels have kind of healed and so you're not going to just spring a leak all of a sudden. So I like 2 weeks and that's why I force people to stay in town for 2 weeks and they're usually pissed because they want to do the surgery and other doctors are like, you can go home, don't worry about it. But I like to keep you tortured here for 2 weeks so we don't have any issues.
Yeah, if you're going to spend the money, you might as well do it from beginning to end.
Well, yeah, but you'd be surprised.
Okay, the next one comes from @Omar's daughter.
Okay.
I was wondering if there is a way to do an arm lift without the long scar.
So arm lifts, what the hell is that? Brachioplasty. First of all, why would you ever want to do that? Some individuals, and it's usually weight loss, sometimes old age, develop looseness in their skin, and that's called bat wings, and I didn't make it up, it's just what it is. So loose skin in the arms that kind of are excess and flat. So depending on the degree of it, depends on like everything that's body contouring. Body contouring is like, this jacket doesn't fit. I take it to tailor, they go into the seams and they remove excess material. So bellies and breasts and thighs and arms, when we lose weight or we have excess skin, we got to go through a seam. The arms have 2 seams. There's the traditional seam, AKA the long one, which by far is the most effective, most powerful, and generally the right answer. And then what is called the short one, which is in the armpit that runs the other direction. Now, every patient wants the short scar. It's the same way in the thigh. You can do short or long, but seldom are patients good candidates because that means that you have such little loose skin that when I just go like this, oh, that looks good. But 90% of people who come in who have like, God, my arms are driving me nuts, have enough loose skin that I need to remove it along the full axis. You can't take out this much skin out of this tiny little incision. It just doesn't work that way.
Yeah.
So, yeah.
I can imagine. Okay, so the next one comes from Cecily.Earl's hair.
Wow. Cecily.Earl's hair.
Right.
Mm-hmm. Yeah.
Do you do lipo on armpits? I have a lot of what I think is fatty tissue that hangs.
So armpits are an interesting area because they're not your regular anatomy. There's sweat glands, there are blood vessels, there are lymph nodes. So you definitely want to do just random shit in your armpits, and you definitely don't want to be liposuction. So people often refer to the area that's in front of their armpits where like it's extra breast tissue. So first thing you got to define, is it extra skin, which most of the time it is. Next thing you got to define is there breast tissue in there. And third, is there any fat? I seldom, if ever, do anything in the armpits because it's just a very treacherous area with lots of important things like blood vessels and lymph nodes. And every once in a while, patients have what's called accessory or axillary breast tissue. They literally have breast tissue that's in their armpits. And we cut that out like a mastectomy and remove that. And that you do when it's necessary. But I'm not a big fan of liposuctioning in that area in general.
And you can tell breast tissue from the rest?
Yeah.
Wow, that's first that I hear of that. Okay, next comes from Sophia Beja 4980.
Okay, let's see it, Sophia. What's up?
Okay, what's the most effective skincare products that we must have without breaking the bank?
Great question. So I've historically not... Skincare tends to be something that is often done by your dermatologist. I dabble in it because obviously it's important to the face as you're doing other aesthetic things. I think that most of the skincare is a bit nonsense, and everybody has got like billion-dollar corporations. We use Obagi brand. Why? One, I think that it's scientific, meaning I think there's some science behind it. Two, I actually think it's affordable. I think that it's, what I always used to hate is like if you walked into a dermatologist's office and you're like, I don't know, and next thing you know, you walk out with a bag full of like 7 creams and you're out $3,000. That's crazy.
Oh, and go on a cruise.
Right.
They're always...
Right. So I wanted products that I think that were reasonably priced. Yeah. I think the Obagi, we have ZO products. And without a doubt, if you can afford only one item, the only item you need is Retin A. Retin A, old-fashioned garden variety Retin A. It's been around for decades. Nothing new has really come on the market as far as I'm concerned. It is amazing because it causes your skin to turn over and it thickens your dermis and gives you youthful things. Now, the thing you need to know about skincare, are you ready? You need to be patient. It takes a lifetime for it to work. People, especially in this world, want it like, boom, like, oh, I put it under my eyes, it still looks the same. Yeah, bro, you got to do this for like 5 years. So it's not about what it looks like today. It's generally preventative. It is, I'm going to use it every day from here on out. And hopefully when I'm 50 or 60, then it'll be when I'm like, oh yeah, man, you look good for your age. It's because I've been using these creams for 20, 30 years. They're not going to make any major impact immediately.
Let me tell you, since I was 15 and I'm very old, my mother would tell me, you must wear cream before you put on makeup. Every day you must wear cream. And I believe what you're saying is it has to be a long-term effect.
For sure, yeah. These are microscopic movements. Obviously, the other thing is sunscreen. That goes without saying. You just want to avoid the sun like the plague.
Well, most creams now have sunscreen in it.
But nonetheless, you want to make sure you're avoiding the sun. That's if you're in the sun, then nothing you're doing is going to work.
And I avoid the sun.
Yes, we can see that.
Yeah, I'm as pale as they come. Okay, so the next one comes from Luby94Lou.
Okay.
Would jaw surgery be an option for a slightly set back jaw, as in would it be worth it?
So if you have a weak jaw, which everyone who listens to my show knows I love jaws. Why do I love jaws? Not as in sharks, but jaws as in the mandible. It's because it makes such a powerful difference in terms of your aesthetic. So if you have a mildly weak jaw, you may be a candidate for chin augmentation, which I do all the time, which is you put a small implant in and it gives the illusion that your jaw is stronger. Now, the ideal candidate for a chin implant is someone with a weak chin, not a weak jaw, right? But you can get away with using it in those two instances. If, however, your jaw is significantly weak, you have a very bad bite, an overbite, then the answer is you need jaw surgery, and they need to cut your jaw and slide it forward. The reason why you want to generally avoid that surgery if you don't have to is it's big, it's expensive, it's painful, and it's major, major recovery. You don't just move your jaws.
Don't they lock your jaw?
They do temporarily wire your
sit.
jaw. It's a big surgery, but very powerful and effective. So if it's mild, I would use a chin implant if you're a candidate. Otherwise, you need to see a jaw surgeon or an oral surgeon.
Okay, next one is takebensmoney.com.
Maybe this is all just a ploy to get him on. Maybe this is advertising. Takebensmoney.com, guys. Go on and check out what that is. Maybe I just gave him a shout out.
Is it normal for only one nostril to work at a time?
Yes, it's a very good question. So very commonly people will come in and be like, I can't breathe very well through my nose. Okay, which side is it? It alternates. Like it's sometimes my right and sometimes my left. And
Does that happen?
Yes. And the reason is because inside your nose is your septum. That's in the middle. And on each side of it are things called turbinates. Turbinates are, think of them as like balls that hang off the walls. And they're there for two reasons. One, to humidify the air. And two, to make the air move in a certain travel. We call it laminar flow versus turbulent flow. Okay? Bottom line is that they're there. And so those turbinates deflate and inflate every 90 minutes and they alternate. So for 90 minutes, your right turbinate is swollen. And that means that you're having a hard time breathing through your right side because there's more turbinate in the way and the air is messed up. Then 90 minutes later, it's going to shrink and then the other one will inflate. And so it is common for people to complain that their nose continues to alternate. So he is very astute observer that his breathing effects are both sides. Now, you can do surgery, shrink the turbinates, fix the septum, etc. But the alternating aspect of it has to do with your physiology.
Has anyone come to you for rhinoplasty to fix their breathing, or is always aesthetic?
Listen, people come to me all the time to fix their breathing in addition to their aesthetics. But if you don't care at all about your aesthetic, then most often you just go to your ENT and they'll do your breathing. I certainly absolutely can, but 9.5 out of 10 are coming to me because they want to breathe well and they want to look better. I got to tell you, it's seldom ever that I don't change the aesthetic, even if it's minor.
Yeah, because when we did the rhinoplasty episode, you were saying that they were surprised that they were breathing better. So sometimes they don't even think about the breathing.
No, and I bring it up to them. So, of the patients who come see me, 20% are breathing issues, 80% are just, I hate the way it looks. But all of them have breathing issues because you have to make sure their breathing is better.
I don't think I could do something if I thought my breathing was going to be worse. Okay, so the next thing is Tanya.Tbull.
Tanya.Tbull or table?
Tbull.
Okay, Tbull.
Can a bad tummy tuck be redone?
Can a bad tummy tuck be done? And the answer is yes, but not really. So certain procedures are easier to read. First of all, no surgery is good to redo. Noses, terrible. Breast, terrible. Abdomen, terrible. Ear, but all surgeries, once someone's mucky with it, it's not, oh, okay, let me just go and undo this. It's not that way at all. The scar tissue, the anatomy is messed up. Some surgeries are more difficult than others. So breasts, for example, are easier to work with than, in my opinion, redoing an abdominoplasty. But having said that, you can redo an abdominoplasty for sure, and I've done many of them.
But isn't there a risk to doing someone else's bad work, fixing it?
Yeah, the risk is no good deed goes unpunished. So the minute the scalpel hits the skin, Doctor Who? I don't remember Doctor Who. You're the man. You just bought and owned all of the issues that came before you. So there are surgeons, particularly mature ones, who have very busy practices who won't do any revisions. They just won't. They just won't touch other people's work. But unfortunately, then a lot of people go without getting help. Poor people.
Okay. Next one comes from @FlyingInsectPolarT.
I'm not going to even bother. Go ahead.
Can patients react to chin implants the way some people react to breast implants?
So great question. The answer is No, not really. The chin implant is a solid implant. It's solid. It's made out of silicone. The breast implant is gel made out of silicone. So silicone is a very interesting material. It can be liquid and it can be a block. And the more it's cross-linked, the more it goes from total water to total solid. And then it becomes a gel, a soft gel, a firmer gel, and then a solid gel. So the way people react to breast implants is that their bodies create scar tissue around it. And because breast implants are in a mobile space, they're just floating around, when the scar tissue forms, it changes the shape of the breast. Chin implants are sitting against the jaw in a tiny, tight pocket. And so when the scar tissue, when the scar tissue forms around it, it just adheres it to the chin even more. So you don't get that hardening. Chin implants are not supposed to be soft. They're not supposed to be mobile. Breast implants are supposed to be soft and mobile. So it's just not an issue with chin implants.
The next one comes from Cynthia at cynthia.in.la.
At cynthia.in.la. Okay, what is it?
What can you do at 40 to help with jowls? I doubt you'd say facelift.
So what we were talking about, and it's become a really popular topic, is this idea of early facelifts, mini facelifts, and it's a very trending or popular topic. So historically, facelifts were things that we did on patients in their 60s and 70s. Why? Because you would only do it when things got really bad, because that's just what we culturally believed. Ironically, we would do someone's nose when they're 16. But why? Because that's what we accept. That's what we decide as a culture. In the last 10 years, it's become much more acceptable, much more common for a person to do their facelifts in their mid to late 40s and early 50s. The key to it is that you have to have something worth the exchange. So as you're starting to jowl, create marionettes and some neck bands, then you can get away with doing a facelift. It's still a facelift, except it's not as exploratory and big of a facelift than this other one. I hate the word mini because it kind of minimizes it. It's still a goddamn facelift. You still have the scars, you still have everything. But now we're pushing the envelope and doing it early and earlier. What you don't want to do, and we just had this conversation with Rosalind, is you don't want to do your facelift before you need your facelift. Like, oh, I'm 39. I see a tiny little jowl. I'm going to go get a facelift so I don't need a facelift. Like, that's not the time to do it. You have to do it when there's starting to be enough signs to be worth the exchange. So I think 40 is on the earlier side. Have I done it? I've done it in 38-year-old, but she also lost like 120 pounds. That's a whole different animal.
That makes sense.
Yeah.
Okay, and the last one.
The last one, fire away.
No, sorry. At browsing F1.
Browsing F1, huh?
Right? Mm-hmm. Browsing. Oh, browsing. That's right.
That's what I said. It's okay. No problem.
I was reading it differently. Okay. What is your favorite procedure to do? I know this.
What is it, Maria?
Rhinoplasty.
Yes, it is a rhinoplasty.
Yeah.
My favorite procedure. Listen, I love all of them. If I only did rhinoplasty, I would commit suicide. If I only did breast augments, I'd commit suicide. If I was only doing tummy tucks, I'd commit suicide. If I only did anything, I'd commit suicide. There is no chef in the whole world who only wants to make souffle. There is no musician in the whole world that wants to only do classic. You want diversity within the area that you specialize in, because it creates fulfillment, because it creates diversity in your experience. That being said, the procedure I like most is rhinoplasty, and the reason is multitude. Number one, it is the most powerful, and it's neck and neck with a chin aug in altering the way you look. You literally can come in, you look fine, you walk out, and you're a supermodel. And you're like, what the how's that even the same person? You can't do that with your eyelids or your ear pinning or your eyebrow lift. It just doesn't have that alteration.
It has the most dramatic effect.
Right. Secondly, it's still kicking my ass. It's something that I'll go do and I'll be like, yeah, man, I'm the man. Yeah, hell yeah. What the and then it'll just punch me in the stomach. And I'll be like, this case was so hard, because it's so intricate and so delicate and so different that it's like that slippery fish that you can never grab. So oddly, that's kind of like masochistic, but it keeps me on edge and it never allows you to get really bored. And third, it's the most artistic, in my opinion, because you can do whatever the hell you want. I mean, literally, you can make it scooped and downwards and turned and nostrils too big and too small. And like, you know, and it's all you. You live and die by your choices. So, you know, and it's millimeters, you know what I mean? So a few here and a few there, and all of a sudden it looks great. And a few here and a few there, and
Well, it's like a work of art.
then it's like,
You can admire it.
yeah. So I like rhinoplasties, and that's my favorite.
So we got it. We
All
got
right.
all our questions.
Well, so interesting. I'll leave you a little sort of a sneak peek. Someone's going to be doing a breast revision. Who's that someone?
Me.
What
finally.
the hell? After 4 long years of
Yeah.
listening to me babble, Maria has decided to take the plunge. She's entering and drinking the Kool-Aid.
The Kool-Aid.
Okay.
Well, I already did.
Yeah, but you've been scared for how many years? How many years ago?
23 years.
Yeah, 23 years. It's safe to say you've been chicken shit.
Yeah.
So we're ready. You're going to do your revision, and we're going to try to do a journey out of it. And so all of you who've been following along with us on the podcast and know Maria, my producer, you're now going to ride along with you through your journey.
I'm an open book.
All right. Well, I'm going to author her book.
Yes. And
All
my
right.
husband will appreciate it.
Yes.
He's been the one pushing me
He's
to do
driving.
this.
He's like, get your ass in there.
Yeah.
At any rate,
Don't most husbands?
I think good husbands are always by their wives' sides, as good wives should be by their husbands' sides, and encourage them to do what they know they want to do that maybe be afraid to do it. So I think that's true. I think your husband's doing the right thing. So that wraps up another episode of Plastic Surgery Uncensored. As always, 2 requests. 1, share this podcast with everyone that you think is even remotely interested in plastic surgery. You never know. They may go do something stupid and you'll wish they had it. The second is we always ask you to write something nice. We always end with this plea and request. Go share something pleasant. If you like the show, you follow us, you love it, share it. We appreciate it. All right, that's a wrap. Until next time, I'm your host, Dr. Rady on Plastic Surgery Uncensored.